Imagine a Pac-Man racing through a maze, attempting to eat all the dots which block its path and disrupt the system. What if I told you that this was actually happening inside your body too? When our bodies face an immune challenge like an infection, white blood cells come along and release Pac-Men to protect us. In our lungs, to keep us healthy, these Pac-Men, or proteinases, are essential to eat bacteria or foreign bodies and to stop us from getting sick. However, these Pac-Men are also capable of eating healthy tissues, such as the lung lining, so they're usually kept in a very tight balance by anti-Pac-Men, i.e. the ghosts, which we call antiproteinases, so that the immune system can attack any infections, but no damage is caused. Understanding the roles of these Pac-Men and how they can go wrong forms the basis of my thesis. In a hereditary version of the incurable inflammatory lung disease, chronic obstructive pulmonary disease, or COPD, there is dysfunction associated with these ghosts, and they cannot stop the Pac-Men. So they don't just eat the bacteria, but also the lung structure. When there aren't enough ghosts to stop the Pac-Men, we call this a proteinase-antiproteinase imbalance. This sets off cascades of inflammation around the body and causes the lungs to become saggy and non-elastic. Air cannot get in or out of the lungs properly, and this is worse in the smaller, deeper parts of the airway where our oxygen-carbon dioxide transfer occurs. My thesis examines this imbalance and how it can be corrected. I have a test which can measure the imbalance in this disease and how much excess Pac-Man activity is present. This is called a biological marker of disease test, or biomarker. I've used this test on patient blood samples to allow the assessment of the Pac-Man footprint in disease, which allows us to tell what type of disease someone has, how severe it is, and even assess how quickly it's likely to progress, allowing for earlier interventions. I've shown that healthy people have low levels of Pac-Man activity, and that people with the disease have high levels of Pac-Man activity. People with a milder disease have an intermediate footprint. My research has further involved developing and validating a test tube model of this imbalance using blood from healthy donors and patients. So I've set up a test tube model to mimic this high disease activity with levels of Pac-Man activity in the model the same as shown in disease. I've tested different drugs to see whether they'd be effective in patients. I've seen how when you add a promising drug which blocks the proteinase or Pac-Man activity to the model, that the Pac-Man activity in the system is reduced. This is important as it suggests the drug could be effective in human and could be used to treat this incurable hereditary lung disease, stop these Pac-Men from running riot, and hopefully to help the world to breathe.